Welcome everyone. My name is Suhavi. I'm working with SNEH Foundation. In this series, we plan on educating and raising more awareness about COVID-19 with the help of specialist doctors who will help us debunk myths and understand the disease and its consequences better. Today, I'm joined by Dr. Ritika Khurana. Good afternoon, doctor.
Good afternoon.
Would you like to start by introducing yourself?
Yeah, I am Dr. Ritika Khurana. I'm attached with SNEH Foundation. I'm a gynecologist, and it's wonderful working with SNEH.
We'll start then. Dr. Khurana, is it safe for women to take the vaccine during their periods?
Yes, absolutely. There's no issue. There's no relation with periods and vaccine. They are two different things. So there's no issue at all.
And उसका कोई effect होता है periods पे taking the vaccine?
During the periods?
Yeah.
No, nothing at all. See, the general reaction or whatever are the general side effects, those are different. If it will be just a coincidence if it does occur, but as such, because of periods, some reactions or some side effects, no, that is not so.
Pregnancy के वक्त COVID-19 के symptoms similar होते हैं or are they different?
No, nearly they are similar. They are similar generally as such. Only thing is what happens is because as such immunity is low during pregnancy, the symptoms are a little more exaggerated. That's all. Otherwise, they are nearly same. It will be the same, whatever. I mean, there is a series of symptoms, as you know, sore throat, cough, fever, and all that. Now it's with, it's going to conjunctivitis also, diarrhea, and all these stuffiness in the nose, headaches, that way. It will be the same.
It'll be the same. If a woman is found to be COVID positive during the first trimester, can she continue with her pregnancy safely?
See, yes, as of now, yes, she can continue because there's no, as you know, COVID is relatively new for us now. By the time, we come to know about the details, exact details, though many studies have been taken place up till now with pregnancy and COVID, delivery and COVID, newborns and COVID that way. But as of now, there's no effect as such found up till now that the virus has any effect over the pregnancy or pregnancy has any effect over the virus. In the sense, there's no much relation as such. COVID is in pregnancy is as in a normal, non-pregnant person also. So there's she can absolutely continue. It's not an indication, outright indication for termination. Like COVID infection is not an outright indication for termination of pregnancy.
जो virus hai, can it be passed on to the fetus during pregnancy?
No, it's not yet proved as such that it passes on.
Has COVID been found to cause any birth defects? Does it affect the?
As of now, up till now, no. Up till now.
Will vaccine?
As I said, why I'm saying up till now is
it's still new.
It's again. Studies are going on, with various cases, whatever. As of now, though now even we have started delivering. I mean, it's now every gynecologist might have delivered a, COVID positive mother. As of now, delivery might have occurred. So as of now, nothing. So in second and third trimester, we have definitely seen COVID infections. Means patients in second and getting affected by COVID infection in second and third trimester, definitely we have seen and delivered, like you got it, and delivered. So as of now, nothing.
Okay, I think that's with almost everything about COVID-19. Ki ab tak we don't know everything. It's still very new, and I think with the second wave, things are changing more and more.
Yes, gradually as time, with time there'll be more and more studies. So, but see, thing is, what issue is like as far as vaccination and pregnancy, vaccination and breastfeeding and all. Thing is that as of now, the prevention of COVID is more important. It's not so that we need to intend to, pass on any birth defects to the baby. But as of now, it's not proven. So taking a vaccine is always better than not taking and getting infected from COVID. It's like you have to weigh which will be the better action. So in that way, vaccination will definitely be a better action for a breastfeeding mother.
Okay. So, do we know anything about if the vaccine provides immunity to the fetus as well?
See, vaccination as such, no, that the antibodies of the vaccine are as of now not known to pass through the placenta. But
Okay.
what happens is the other antibodies, some few antibodies do pass on.
Okay.
So as of now, if you say that vaccinate for the baby, no, as
No.
such, no. Like it will have any direct effect, as such, no. As of now, again, I'm saying. But for the mother, it's definitely, it's safe.
For
So
safety,
safe in
yeah.
the sense it will be beneficial, yes, to the mother.
क्या आपको लगता है कि pregnant women at this time should get deliveries done at home or in places other than hospitals? Is that safer?
For COVID, as in this COVID scenario.
Yes.
No, no, definitely no. It has to be an institutional delivery. It has to be an institutional delivery. No way. I mean, because of COVID infection, you're going in for an home delivery or some other place. No,
So it
definitely.
will be more dangerous, you're saying, that there's more
Yes,
exposure
yes,
to the virus.
yes. Because see, the medical and the paramedical personnel know what exactly is the effect of the virus and on delivery and on pregnancy, and they can combat those side effects and complications. So definitely, it should be an institutional.
Um, if a woman is pregnant and she finds out that she has come in contact with a COVID patient, would you suggest that she get tested immediately?
Tested immediately. Yes, 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 definitely. If she is
Okay.
in contact, definitely she should go because then we can act accordingly. There's no, I mean, there's no, it's not a taboo. Like it's a simple
Okay.
infection. We can act accordingly and prevent further complications of pregnancy. So definitely it should be diagnosed as early as possible, as soon as the patient is found to be in contact with a infected person.
If the infection, if someone does have a very bad COVID infection, is it safe for them to continue breastfeeding?
Yes, yes, yes. Unless, see, with mask, with all the safety precautions, mask, cleaning of hands, and in just in case, very rarely, there sometimes it is seen that the patient is very weak, very debilitated and cannot breastfeed, then it's a different thing. I mean, she doesn't have the strength to breastfeed,
Yeah. Okay.
in very simple terms, if I say, then that's fine. But as such, breastfeeding is again not a contraindication for a COVID positive mother also.
Okay.
With double
So
mask or with good mask and clean hands, she can definitely
so there's no
follow the process.
transmission of the virus through breastfeeding.
No, not nothing as of now. Not through breast milk, but yes, with contact. But
Yeah.
again, the breast milk is more beneficial to the baby.
Hmm.
It passes on antibodies. It's the
Antibody.
first immunization actually for the baby. So that advantage is more than the baby getting affected with COVID. So always it's better that she continues breastfeeding if the patient can.
So during these times, we all know anxiety, stress काफी high है सबका, सबको tension लगी रहती है because जहाँ भी देखो it's so
Definitely.
much bad news है ना? It's there's
Correct.
at this point there's no way to escape it. आप ये भी नहीं कर सकते. टीवी ऑफ कर लिया तो फोन पे किसी से बात कर ली तो
Mm.
वो भी कहानी सुनाते हैं. So does all this stress and all, does it cause any changes in the menstrual cycle for everyone?
हाँ डेफिनेटली सी क्योंकि मेंस्ट्रुअल साइकिल जो है दैट इज अगेन with I mean related with the brain in the sense brain controls जो hormones है it is controlled by hormones जो भी activities हैं body में especially the menstrual cycle pregnancy and all these तो menstrual cycle is controlled by hormones are secreted in the brain में जैसा एटमॉस्फेयर रहेगा जैसा आपका मेंटल स्टेटस रहेगा दैट डेफिनेटली अफेक्ट्स जो
अच्छा.
हॉर्मोन्स है तो बिकॉज ये हॉर्मोन्स का रिलीज विल बी अफेक्टेड तो इवन मेंस्ट्रुएशन विल चेंज डेफिनेटली इट डज एंड ये एक डायरेक्ट इफेक्ट है द अदर इफेक्ट विल बी लाइफस्टाइल चेंजेस जो हो रहे हैं eating habits sleeping habits and working like sit and work weight gains that again that also is related with I mean that affects the hormones का release और उसके वजह से again menstrual issues डेफिनेटली होते हैं
Okay, so is it very concerning जब ऐसा कुछ हो या हम
no no no
it's
no
normal?
unless there's anything no it's normal so get yourself evaluated with the go to the gynecologist and get yourself evaluated कि कुछ और तो नहीं crop up हो रहा है
हाँ, okay.
and then he or she will definitely guide you कि कैसा है but this occurs.
And does getting COVID have any effect on the menstrual cycle, like post-COVID? Should there be any differences?
It may I won't say that it doesn't I won't say that it does बट इट मे हो सकता है क्योंकि अगेन एज आई सेड कि जब कोविड होता है तो आपका मेंटल कंडीशन कैसा है, देखिए स्कैरी फीलिंग तो है ही सबके इसमें, चाहे कोई भी हो। एंड वो अगेन उसका मेंटल स्टेटस कैसा है, कैसा ईटिंग हैबिट्स रही हैं, बिकॉज ऑफ दैट हॉर्मोन्स का रिलीज कभी कभी थोड़ा सा हो सकता है, तो इट मे अफेक्ट,
अच्छा।
हो सकता है।
जैसे जो हम कोविड को ट्रीट करने के लिए द मेडिसिन दैट वी आर यूजिंग, ऑल ऑफ दोज डू दे हैव एनी इफेक्ट?
हाँ यस, इवन दे कैन हैव, डिपेंड्स अपॉन द इंडिविजुअल। अगेन
ओके।
एज आई सेड, होएगा ही ऐसा है, ऐसा
हाँ।
जरूरी नहीं, नहीं होगा ये भी नहीं। और इट डिपेंड्स अपॉन द इंडिविजुअल ऑल्सो कि वो उसकी बॉडी कैसे रिएक्ट करती है टू द ड्रग, तो वो भी एक इम्पोर्टेंट फैक्टर है, तो वो भी हो सकता है वैसे।
थैंक यू डॉक्टर, आज के लिए मेरे पास इतने क्वेश्चन हैं आपके लिए। थैंक यू सो मच।
ओके,
वेरी नाइस टॉकिंग टू यू।